Hello, my name is George Swan. I'm working in the United Arab Emirates now, and the subject of this short video, I hope it's short, is about a pivot table in the USA comparing hospitals, what's possible in making large data sets available within a country to compare hospital measures, quality indicators, that sort of thing. So if you want any information about this, you can call me in the UAE or send me an email, and I'm happy to have a discussion with you about this. So this is actually part of a larger presentation on hospital benchmarking. I've dug into quite a few different aspects of this, and there are some videos on other topics. This one is going to be look at, is there a reliable or a helpful model anywhere in the world that we could actually look at? Because I've been to the Australia sites, New Zealand, Canada, NHS in the UK, the United Kingdom, and even in the USA, it took me a while to really find what I'm going to share with you today. But I think you'll like it. In fact, I think I hope it's going to impress you the way it did me. We want to talk about this a little cluster of hold-ons. We kind of think of the hospitals and the clinics, and for the most part, people go in, they work, they take care of patients who arrive. They're not too concerned with a lot of the work that's done outside in the healthcare industry, but we are part of a bigger industry. For that matter, patients leave our hospitals and clinics and they go into the community, and how they take care of their own health. That would be a level of what we would call population health or community engagement, and that is also something we do a little bit, but we're not really as concerned as we might be. We should be for the most part. And then of course at the country level, in our case here in the United Arab Emirates, you need data from the hospitals and physicians to be consolidated to put a country set of data together, and without which it doesn't work. And you have to do that if you're going to report to the World Health Organization, OECD, the Organization of European Countries, and again in the Middle East it would be the Gulf Coast Conference to compare, for example, the UAE, like that. And this is an example of what I downloaded from World Health, just looking at some countries in the UAE side by side. You can see a lot of blank cells. There's also a problem of timely data. Countries sometimes are 2 or 3 or 4 or 5 years behind in actually reporting statistics. So WHO needs a systematic approach to bring data together for hospital comparison purposes. And you might get some ideas about that from this little set of hospital benchmarking videos. One of the first sites that I really was impressed with, California has 460 some hospitals. You can actually go to their site and download. You can see this type of information about the quality of care, about health facts in California hospitals, financial information. Every hospital in the United States has to download their cost report information, and it's quite detailed. If you go to the California site, you can actually see a data set about that. Now, I will say they are better than most of the states. You can't do this in Colorado, but this information is provided for the most part in a flat file. And what I'm suggesting is that everybody with these large data sets, they can make a few basic pivot tables for the public, for researchers, for interested business executives to look at, hospital people, public health, so that normal people can actually look at data in a rather easy way. Ohio, we've used that in an earlier video to compare the hospital satisfaction questionnaire data, and they also provide a very nice set of information. They actually have a link to CMS Hospital Compare. Now, it wasn't really obvious when I went into this site how to get a hold of data to make it, interesting and find what I was looking for, which is just a side by side, the ability to look at different hospitals side by side for key data. That's what we're kind of talking about here. So if you go to this Medicare.gov website, and I'll just save you a lot of trouble. You go to you can find data on physician licensure, for example. There's over 1 million. It won't work when I downloaded or tried to download a comma delimited flat file, a CSV flat file. So for big, large files of more than 1 million rows, you really need to go to Microsoft Access, and I'm not that skilled, in it. And I'm sure there are people more skilled in pivot tables than I am, but I'm going to show you what I've been able to do. So if you go to this website and you click on that CSV, you get this kind of a list. And you can see some of these files are really, really big, 46 megabytes and so on. Well, instead of doing that, I've already downloaded this website. It takes a little bit of time to download all these files. And so what I'm going to do is just get out of the pivot table for a moment. I'm going to go to this file here. And this is actually what you get at the Hospital Compare data sets. Yeah, and you can see there's a lot of data. What I want to look at is this comma delimited file on hospital timely and effective care as an example of what we want to see. So if I double click on that, I click into Excel, should open up for me. Let's try that again. Okay, here I am. Okay, now this is a comma delimited file. It's got 217,000 rows in it. I've got the provider ID control number from Medicare. I've got the hospital name. I've got address, city, state, zip code. I've got the county name, a phone number, and then I've got these various conditions of measures, and this is a kind of a short code here, and over here are these measures, and this is the score, the result of these measures from 2013 data for all the hospitals, 4,600 some hospitals in the United States. Now, it doesn't have bed size. I'd like to see them add a couple more, kind of filters in this, but this is pretty good for starters. Now, you'll notice this is one flat file. There are no pivot tables here, and I'm going to show you how relatively easy it is to do, but I'm a bit experienced in pivot tables. Most people, they don't want to bother with that too, but they would love to be able to work with a pivot table that's already set up. And so why Medicare doesn't already just set up a couple of pivot tables for people to work with. So how do we do that? Well, great. So anywhere in this data set, when you find a big flat file like this, first thing, and by the way, you could go to YouTube and watch a 15-minute YouTube on how to create a pivot table from Excel. It's worth your while to go there. It's worth your while if you like data to find out how to do a pivot table. It's surprising to me how many people do not know how to do a pivot table, and it is easy, you're going to see. So when you're in a flat file like this, first thing you want to do is format as a table. This little icon is neglected. I can go over to insert, I could insert a pivot table, but it will not be as good as if I first format this data as a table. And all you do is just pick, I like to pick a light little table like this, and automatically you get all the rows are kind of highlighted dark and kind of light and dark rows, so it's easier to read when you're going across from one left to right. And as you scroll down, you'll notice that it holds the headers at the top of the data so you can see when you're way down at the bottom. You could also, it's got little selection buttons, so if you wanted to look at one state, for example, so I'm from Colorado, and if I pick Colorado like that, and then I said, well, I'm from Denver, so I'm going to click on this, deselect, and I'm going to go down to Denver, and right away I have all the hospitals in Denver. And if I wanted to even go here and deselect it and say, look at Denver Health, one of our big go-to hospitals in Denver, I automatically have all of the data for Denver Hospital right here. There's the scores, and that's really outstanding, just like that. Just to be able to do that. However, if I'm in this website and I go up here, I have these table tools here so I can do a few other things, but this is what we want to do. Summarize it with the pivot table from a formatted table. I click on there, click over here, and I automatically have a pivot table. And, I'm saying, well, here's all the fields, and, what do I really want to look at? Well, I want to look at these measure names. So I click them in there, and I have every measure that the hospital reports on timely and effective care, because that's there's other files, but this has timely and effective indicators. You'll notice that they're all in alphabetical order. It's really nice to be able to take a condition, for example, and put it in the front. So now I've got the blood clot prevention and treatment. I've got everything ordered in a nice kind of way. And then I want to say, well, I do have some longish names here, but what I really want to pull out of here is the score, right? And I bring the score, I put it down here in the values. It keeps flipping over here to, a longish kind of a column width. And the reason for that is because this field here is a little bit large. So if I just trim this down a little bit, and I I'll try to do this newborn. So this is about newborn deliveries, and they were scheduled. I'll take out all this unnecessary wording. Scheduled early. And, this all about not medically necessary just means low risk. Sorry, these are high risk, right? So what that does is lower this to a little more reasonable set. This one here is about beta blockers. These are surgery patients on a beta blocker prior to arrival who received a beta blocker during, peri-op period. I'll try to just say peri-op. And, I'm watch my spelling here, right? So, yeah, I don't even know why that's, so that's peri-op, and who received a blocker. Maybe we can even get a little bit shorter here. I think that's gonna do it. And then here's another one, a surgery patient who received appropriate. Boy, that's a long word, and it just extends the column out as you work. So we're just going to try to trim it down. We're just going to say, within 24 hours, right? So that's basically what we're trying to get at. So pardon my spelling if I enter that in. Now the point is that we also, you remember we had this? So we're going to look at the count of scores. In fact, here. Okay, so now I got a nice short column, and I've got this information at the top, and it's the counts. And it just for 4,619 hospitals, it's counting how many scores. I don't want to see the count. I want to see the average. So what I'm going to do is left click, look at the field settings. I want to look at the average, and I like to go to the number, because I've just found out that if you don't do this, then the numbers all end up in long decimals. So if I click on that, I have the average, score here. I could even change that and call it the average score. Click OK. Now I've got the average score in the United States. Now just think about this, what I have here. In just a few minutes, I have I'll even put in a title here, all hospitals in the USA from Hospital Compare. I'd probably put a little hyperlink in there so you'd automatically click on that. And so this is all the hospitals in USA Hospital Compare. These are all the percentages for the entire United States. Now, number one, what if I wanted to look at a few more numbers? So if I grab this score and I put it down underneath the average, I get the count. Again, I right click on that. I want to look at the max score here. I'm going to change that title a little bit to max score. I'm going to go to my number format, change that to one decimal, like that. Click OK, and OK like that. And now I've got the maximum score, and if I put that over here, what's goes next to the maximum? I want to go look at the, not the count again. Click on that, modify it. I want to look at the minimum. So same thing. That's the minimum score. Go to number format, click it, one decimal, and just like that. If we put the average like over here, so now I've got the maximum, the average, and the minimum scores. That is breathtaking. Just think about what you have here. All the hospitals in the United States, this is the average score for all of these indicators: blood clots, children's asthma, emergency department measures, heart attack, chest pain, heart failure, pneumonia, pregnancy. I mean, if this doesn't impress you, I don't know what will. Well, how about this? We're in this pivot table, and there's a little tool that appears up here saying, well, we have some special pivot table tools. So one of them is this insert slicer. So what if I wanted to look at a state, or maybe even at the county level? I put in these slicers, and so right off the bat, just like this, right, I can, let me just shrink it up a little bit so it doesn't hide our results, right? But let's say I'm from Colorado, so I click on Colorado, and just like that, I have the average score for Colorado with the maximum and the minimum of all the hospitals in Colorado. There's about 250 or so hospitals in Colorado. And if I wanted to look at, let's say I'm in Denver. So I click on Denver, and now I've got the average of hospitals in Denver. And you can see that, the average for blood clot prevention is a little bit lower than what it is for the USA as a whole. I mean, look how quick. If I want to look at, I want to look at Colorado again. I deselect the counties. If I want to look at the U.S. as a whole average again, I can see all those scores. And if I wanted to look at another, state, there's Washington, D.C. If I look at, California, there's all the averages for Colorado. Now, my point is, why isn't this data set, if I go down here, that little tab, and I call this, PIV1, let's say call it the max min pivot table. Why isn't this little max min pivot table included when I upload this file? I mean, and it's just so easy to look at. I hope you'd agree with that. Now, let's suppose that we wanted to do some comparative information. So if we click on here and I come over, I just move or copy, I can take all the work that we've just done, click it over here, and now I've got another. I like to put my data set over in the front on the left. Pivot 1 is maximum minimum. Now let's say this is going to be, we're going to make a compare pivot table. So when I compare, I don't need the maximum data and I don't need the minimum, so I just pull that out. Here I've got the average. So let's say I want to compare California and Colorado, right? Well, where is it? So I have to come up into this selection. I have to take these states and I have to put them side by side like that. There's California and Colorado, side by side. And, frankly, I could do the same thing with hospitals. Let's say, this is to compare states, S-T-A-T-E-S. Let's say I took this one, and again, I want to move or I want to copy that. So I'm going to move it to the end, and now this is going to be my third, and I didn't give that a name, but I like to number these pivot tables. So pivot 2, this is pivot 3, but this is going to, instead of states, this is going to be hospitals, right? So what do you think I have to do here for the hospitals? Well, first of all, I would deselect most of this information. This, by the way, has a side-by-side of all of the indicators for every state in the union, which makes a pretty long table. But, how's that for taking your breath away? Every state in the union, the average, and if I wanted to sort this information, I could push a little bit. Let's wow. Let's just see how that works. If I go to the sort here, so I want the largest to the smallest. So, I want to look at the worst measures first. So each state has got the measures here. And I think what I've done is I've actually done it upside down. I'm going to reverse it by Control Z. Okay. So what I want to do, I'm going to take these states out. Okay. I'm here with this information, and I want to pick on Colorado. I want to select Denver, but I want to add one more slicer here. So again, I go to my pivot tools, click on my slicer. I want the hospital name to pick from. Okay, so here's all the hospitals in Colorado. And I want to compare Centura, and I know these hospitals. Denver Health is a great big kind of a go-to hospital, biggest in Denver. I control click these three, and I'm over here with the average score. What do I have to do? I grab the hospital names and I put them in the columns. So just like that, right? I have these, they're long names, so I'm just going to kind of shrink down the columns here. But so now there they are, Centura, Denver, and Rose hospital. We can move this little slicer out of the way a little bit. And, you know, you can move them around to make them easy to access. But another thing I like to do is click on this borders just to make a nice little name for myself. And if I click on this, block the area that contains all of my results, and I've got it set up here so I can set the print area. If I go to the print preview, I can go to page setup. As a portrait, I can fit 1-to-1, and in just a few minutes I can print the comparative data for 2013 side by side with each of the hospitals. And if I'm Denver Health, you know, I like to compare myself. I can see I'm not doing as well as Rose Medical, but I'm doing better than Centura. But I can compare myself to any other indicators of any hospital in the United States, by bed size, by ownership, you name it. What a data set, what a bonanza, and what a great example of what Medicare could do if they set up these pivot tables. So I'm going to send this to Medicare and suggest that they just add these pivot tables into their CSV file. It doesn't add any more space to the size. You're already at about a 60 megabyte file with that CSV. By the way, you know, there are ways to minimize that. I won't go into it here, but if every hospital in the union could just say, here's the link. If you want to compare our hospital to any other hospital, just go into the national database and select your hospitals, and it could already be, you know, set up that way. So people that don't really want to fuss around with learning pivot tables, they just could use them right here. And that's my argument. So if we go back into our, let's say, our pivot table here, you know, this is what it's like. Obviously, I could put this kind of report as a flat file on my website. And I'd say just compare. I could pick all the worst hospitals in the, you know, in the area if I was better, or just be open about it. You know, just because it's a low number doesn't mean that it's bad. It means I could have all the high-risk cases, and you know, you cannot be punishing people just because their indicators are on the low side. And I don't think we have enough of an engagement about the problem with these KPIs. If you take them too seriously, they can poison the whole availability. People don't want to publish this. So again, if you want to have a discussion with me about any of this, please feel free to send me an email. I'll be happy to send you the, you know, any of the links or any of the pivot tables that I've done. And you know, I hope this becomes available to you through this site in the near future. And just to every other country, you know, you should do the same thing. Every hospital, every physician that supports this openness, this transparency of information, could create simple pivot tables like this so everybody can see, and then we can work together to improve the indicators to support better quality health care for everyone. Thank you very much.